Martin Lewis's mental health charity wants an investigation into the insurance industry after it found that people with mental illness are being charged vastly more for their travel insurance, even if they've recovered. The Money and Mental Health Policy Institute was set up by the money-saving expert Martin Lewis in 2016, and he funds it. It compared quotes from 15 travel insurers to try to test how disclosing different health problems affected the price you're charged and the cover you get. And it wants the industry regulator, the Financial Conduct Authority, to look at how these prices are calculated. Conor Darcy is Head of Research and Policy at the charity. Conor, good afternoon to you and welcome to you and yours. You did this sort of mystery shopping exercise for travel insurance with 15 different companies. You found they're charging people with mental illness more than they're charging people with other health problems. So how much more?
It varied. So we wanted to get a sense of how people with different conditions might be affected. So we looked at people with depression and with people with bipolar disorder and a kind of a range of circumstances as well. So some people, as you were saying, where they had, historically might have had a condition, but it hasn't affected them for years. People who still take treatment, but have it under control, and people who might have more severe conditions. So we found that for, people in that more severe group, where maybe they've had more recent experiences, on average, someone with bipolar was being charged about 11 times more than a customer without a similar condition. But that was the average across the 15, and it went up to as much as 27 times more. So some really massive increases. And I think when we speak to people with mental health problems about this, we've heard of some examples where the price that they're being quoted for travel insurance was even more than they were paying for the flights for the holiday that they were going on. So it really raises questions about the affordability, about the level of access that people have to what can be that really invaluable peace of mind that we get from travel insurance.
Did you test how mental illness compares with other physical problems?
Yeah, we looked at that. It's not the kind of the core of what we've dug into. But I think, again, what we've heard is the different treatment that sometimes it gets. So someone we spoke to said how she also has asthma, and she's asked if...
Well, we're going to hear from her.
I don't want to... I'll let her explain her story.
But the basic thrust of it was that you did a lot of interviews as well, and that people feel that mental illness carries a penalty that a physical illness wouldn't.
Yeah, and I think sometimes it comes down to that length of time over which the conditions are relevant. Like if you've ever had a condition, that is how sometimes it's phrased by insurers, so that something that has happened years ago could still be driving up prices for you. But I think it's also probably to do with, I think, the questions around that data, where with physical data, I'm sure it's not perfect, but with mental health, there's been so much progress in society over recent years, so much change in how we talk about it and how we treat it, that I think there's questions over how relevant that sort of longer term picture is now.
Well, let's hear from that woman you mentioned, Emma. She's 30 and she lives in Newcastle upon Tyne.
I was diagnosed with bipolar disorder and OCD 5 years ago, following quite a severe mental health breakdown. And prior to that, I was an intensive care nurse, so quite a high stress job, and it all came to a head. And then I was diagnosed. So it's reasonably new, although I did know that I had underlying depression. I just had never wanted to talk to anyone about it before that point.
How does it affect your day-to-day life now? Are you still able to do the things you did?
I wasn't able to return to shift working. Sleep is integral to mental health recovery. So doing night shifts and long days and, lots of sporadic hours isn't helpful. So I set up my own businesses to manage around my health rather than, having to take lots of time off work sick. So there's a lot of good opportunities from that. But I think it's taken quite a long time to get used to the fact that I am just going to be unwell sometimes. You do kind of grieve who you were and the life you had, but I think that's quite natural in a lot of stages in life anyway. It's just you're confronted with it a little bit more heavily when you have a diagnosis like that.
How has it affected you when you have tried to buy insurance then?
So with bipolar in particular, it pushes the premiums right up. I did some comparison searches this morning just for some updates, and every time I do it, it makes me, frustrated all over again. So just for declaring bipolar alone for a 2-week trip of travel insurance, it's added an extra £50 onto a premium that was only a £20 price just because I've ticked to say I have bipolar. Then when you dig in a bit further, if you say you've had a hospital admission within the last 2 years, it goes up to £250 for 2 weeks. And even if you say you've had a hospital admission within the last 5 years, it still goes up to £124 from £20. So you really, being penalised for the history of your illness. In the past, it's actually got to the point where the insurance has been more expensive than the flights.
It's the same with any illness, though, isn't it? It's the same with a physical illness. I know that you have asthma, don't you? If you declare that, does that not push your premiums up as well?
So when I declare asthma, it goes from £20 to £21. When I say that I've had a hospital admission with asthma in the last year, it goes up to £23. And to me, my asthma is much more life-threatening if I do get sick than it is bipolar. I'm much less likely to become unwell from bipolar than I am from asthma, in particular the types of active holidays that I would go on.
Why do you think that insurers charge so much more for mental than for physical illness?
I think there's a huge lack of understanding and a huge lack of data and a lack of transparency around what data they are using to create these algorithms.
What could insurers be doing to help you, Emma?
You could be a very well person who just happens to have, a really big diagnosis like myself and be really, really fit and well and low risk. But there's nowhere for me to justify that or to provide medical evidence to say that I am a very stable individual. I'm fitter and healthier than a lot of people who are declaring other conditions. So if there was an opportunity to provide some form of medical evidence to challenge that premium, that would be really helpful.
So that's Emma's story. Conor Darcy, insurers are legally allowed to treat people with disabilities differently because they are being asked to insure risk. So what is it that you want the Financial Conduct Authority to do here?
So in the Equality Act, which people might be aware of, it deals with discrimination and protected characteristics. One of those is disability, which mental health problems can come under. There is that exception that allows insurers to treat people differently. But there is an important caveat to that. It's that they need to have good quality data that's reliable and accurate and relevant to people's situation. And I think as Emma was getting at there, from her experience, she doesn't know what that insurer is basing that decision on, what those huge increases relative to other conditions are based on. And as researchers, we went and spoke to firms and they tell us that they use claims data or, medical research, but they're not sharing that. It's not visible. It's all these decisions are made behind closed doors.
So you want the Financial Conduct Authority to look at the data, as Emma said, to investigate the algorithms.
Exactly, yeah, because they're the ones with the power to do it, and they can understand that, is this, just a fair decision and actually that's accurately reflecting risk, or is there more that could be done here to update data to make sure that it is really reflecting different experiences like Emma was getting at?
Well, we asked the Association of British Insurers about this, and they said there are already standards in the industry there to support people with mental illness, and those standards include using up-to-date data and credible evidence for reaching decisions. So you were saying to that, we'll prove it then?
Exactly, yeah. And I think that's a really good step, and there is more discussion of these issues now in the insurance industry. But I think there's just such that lack of trust that's there, that people just don't believe that their insurer is treating them fairly. They feel discriminated against, that being more transparent, more open, explaining how these decisions are reached and what options are available to people would just go a long way to improving that circumstance. But I think the FCA, ultimately, the regulator, needs to have a look at what data is being used to really reassure people that this market is acting fairly.
Conor Darcy from the Money and Mental Health Policy Institute. Thank you. The Financial Conduct Authority said to us that they take any reports of customers being treated unfairly seriously and will take action where appropriate. Listeners are emailing us about this already. Karen says she raised this problem with the Ombudsman, that's the independent arbitrator, in 2020. She said, my husband had no previous history of poor mental health and was diagnosed with clinical depression. We had to cancel our holiday because the insurance policy had a complete exclusion for any mental health claim. Changes here are well overdue.